hospital. We had 6 different areas where we were given names of possible patients, where I would have to go and find all these patients, look through their records, and try to figure out, yes, indeed, they're enrolled or not enrolled. With the new database, it takes those 6 areas that we were looking at, puts them into one, and gives me a list of patients every day that I'll just go and see. So it's really made life easier, more practical, and cost-effective for the whole program.
Yeah, we, like so many other hospitals now, have a very large heart failure clinic. I think what will differentiate us is our ability to track those patients throughout the system. Pre-clinic, clinic, inpatient, post-patient.
Back then we had 80 patients in the pilot. So it was pretty simple to manipulate those patients on an Excel sheet and manage them. Looking forward 4 years now, we have 745 patients, and the Excel sheet is horrendous to manage. I inputted all the data, all the demographics on the patient, all the medications. It really not only is unmanageable, but after a while you can't even find what you're doing anymore.
The new dashboards that are available now from Lumedics actually work. They're very good. I've seen a lot of dashboards that some people can get some data out of, but it really takes a lot of work. The new dashboards, the reports are very easy to access the data. The data can be drilled down to very, very small levels. In heart failure, it's going to be tremendous for us because obviously length of stay is critical and cost is critical. And it's really hard for us to get our hands on that. This will allow us to get that information independently from finance anytime we want and drill down to clinical and financial information that we wouldn't have access to any other way.
How we could see how our patients were doing on the readmissions and how the mortality rate was doing and the cost. It was really phenomenal for us. With this database, we're looking to connect not only our home care agency and the telehealth that's incorporated in that, but also our outpatient clinic, which we have 2. We have an infusion center, and we have the regular clinic. So, and the physicians' offices also in our sister hospitals. So to connect and to get rid of those gaps is so important in the continuity of care of these heart failure patients to prevent readmissions. So that's going to be down the line for us and help us do that.
Well, one of the innovations that we hope to have in the future too is have the patients interact with that information system. So this will be used by not only the providers but the patients to better manage their care. That will be what will differentiate us in the future and provide better care at more cost effectively.
When I first met with Lumedics, they had one question for me. If there was one thing I could have, what would that be? And I said, easy. And I have to say, it's been that way since the beginning with Lumedics, and very easy and comfortable and enjoyable.